Conjunctivitis, also called pink eye, occurs when the conjunctiva covering the white part of the eye becomes inflamed or infected. Many cases of conjunctivitis are associated with allergies, but can also be caused by viral or bacterial infections. During conjunctivitis, blood vessels within the eye dilate and fill with blood, causing redness and inflammation. The eye feels irritated, and in some cases there may be a yellowish discharge that can cause the eyelids to stick together. Conjunctivitis can be very contagious. People who have it should not share anything that they touch. Not everyone with redness in the eye has conjunctivitis. Sometimes there are more serious diseases, such as damage to the cornea, angle closure glaucoma, or inflammation inside the eye that causes the conjunctiva to become inflamed and pink. Conjunctivitis rarely affects one's vision. If vision is affected, if there is a discharge, any light sensitivity, or if the problem does not resolve within a few days, patients should see an eye doctor immediately. Blepharitis is a chronic inflammation that affects the eyelids and eyelashes, and it is one of the most common problems doctors see in their office. A frequent problem in both children and adults, blepharitis often causes redness and swelling, as well as itching and irritation of the eyelids. Among the most common causes of blepharitis are poor eyelid hygiene, excessive oil produced by the glands in the eyelid, bacterial infections, and allergic reactions. A chalazion is a small, firm bulge in the eyelid, caused by a blocked opening or infection of the oil-producing glands located in the upper or lower eyelids. They are frequently associated with a condition called blepharitis. Chalazia may be uncomfortable, unsightly, or interfere with vision. They are initially red, swollen, and tender. In rare cases, the chalazion may grow large enough to apply pressure on the eye, causing droopiness of the eyelid and blurred vision. Dry eye is a chronic condition that results from an insufficient production of tears or excessive evaporation of the tear film. Dry eye affects millions of people worldwide and is one of the most common reasons that patients visit their eye doctor. Dry eye is usually associated with dryness, scratchiness, or burning of the eyes. Some people experience a foreign body sensation, a feeling that something is in the eye. The condition can also produce watery eyes because dryness can stimulate excess tearing as a reflex. In its early stages, dry eye causes mild discomfort, but it may become very uncomfortable as the condition progresses. One of the keys to improving this condition and avoiding damage to the eyes is to recognize the symptoms of dry eye early and to seek treatment for it. Without treatment, chronic dry eye can lead to eye infection, scarring, and possibly impaired vision. Dry eye has many causes. Some causes are from various external influences, such as one's environment. Other causes are related to changes in the body's nervous, hormonal, and immune systems that can occur over time. When a person has chronic dry eye, inflammatory changes in the tear-producing glands and in the eye's surface can interfere with the production of normal tears. When this occurs, the eye produces fewer tears that are less effective. This results in a tear film that evaporates more quickly than normal, which provides less moisture and protection for the eye's surface. With the tear film's protection diminished, the eyes may experience painful symptoms of dry eye, and damage to the eye's surface may occur. A person's age, health, environment, and lifestyle can all affect one's risk of developing dry eye. Dry eye is more common among people over age 40, and especially among women around the age of menopause. Patients with systemic inflammatory conditions, such as rheumatoid arthritis, lupus, rosacea, or Sjogren's syndrome are also at risk. Certain medications can worsen dry eye and its symptoms. These can include certain medications for the treatment of depression, high blood pressure, allergies, hormone replacement therapies, and diuretics. While they are not the root cause of the condition, environmental factors including air pollution, dry weather, and persistent wind can worsen the symptoms of dry eye. Heating and air conditioning can create similar environmental conditions indoors. Everyday activities such as driving, reading, focusing on a computer screen, or watching television can also worsen dry eye symptoms. It is important to remember that dry eye is not just a minor discomfort. Dry eye is a serious progressive condition that can potentially lead to serious vision problems. The key to improving this condition and avoiding damage to the eyes is to recognize the symptoms of dry eye and to seek treatment for it. Many people never mention their dry eye symptoms to their doctor. There are several effective treatments available for dry eye patients. Doctors can help patients relieve or improve their dry eye symptoms. Ask your eye care professional about your options. Your eye consists of delicate tissues that must be treated carefully. When you wear soft contact lenses, they are medical devices that can affect these tissues if worn improperly. Because soft lenses act somewhat like sponges to absorb and hold water, they can also hold debris and microscopic organisms. These can build up in a soft lens as it ages and cause redness and irritation to the eye. Replacing your soft lenses as often as recommended by your doctor will help in keeping your eyes healthy and reduces your risk for developing serious infections. For more information, ask about healthy lens wear. Keratoconus is a degenerative disease of the cornea that causes it to gradually thin and bulge into a cone-like shape. Since the cornea is the main focusing lens of the eye, any distortions in it lead to a distorted image projected onto the retina. As the disease progresses, the cone becomes more pronounced, causing vision to become more blurred and distorted. Because of the cornea's irregular shape, patients with keratoconus are usually very nearsighted and have a high degree of astigmatism that is not correctable with glasses. A pinguecula is a yellowish growth that forms on the conjunctiva, usually on either side of the cornea. Pingueculae are thought to be caused by exposure to ultraviolet radiation, wind, and dust, and are common among people who spend a considerable amount of time outdoors, particularly in very sunny environments. A pterygium is an abnormal wedge-shaped growth on the cornea of the eye. This elevated growth is the result of an abnormal process in which the conjunctiva grows onto the cornea. It is not a cancer. The exact reason pterygia occur is not completely understood. However, long-term exposure to ultraviolet sunlight and chronic irritation from dry conditions seem to contribute to their development. Pterygia are more common in people that live in tropical environments. A choroidal nevus is a flat, benign, pigmented area that appears in the back of the eye. A choroidal nevus represents an accumulation of pigmented cells in the choroid. Choroidal nevi present no symptoms and will usually have no effect on vision. Fuchs dystrophy is an inherited condition that affects the endothelium, the delicate innermost layer of the cornea. Fuchs dystrophy occurs when the endothelial cells gradually deteriorate over time. Once lost, these endothelial cells do not grow back, leading to corneal clouding, swelling, and impaired vision. In the early stages of Fuchs dystrophy, patients notice an increase in the appearance of glare and increased sensitivity to light. As the condition progresses, vision may be blurred in the morning, then sharpen as the day goes on. As the condition worsens, vision may appear blurry throughout the day. Fuchs dystrophy affects both eyes and is slightly more common among women than men. It usually starts to develop around 30 to 40 years of age with no apparent cause. If vision becomes severely impaired, a corneal transplant may be required. Strabismus is the term used to describe misaligned eyes. There are many types of strabismus. If the eyes are crossed, it is called esotropia. If the eyes turn outward, it is called exotropia. In some cases, one eye can turn higher than the other. The higher eye is diagnosed with hypertropia, while the lower eye is diagnosed with hypotropia. The condition may be intermittent, constant, or it can alternate between the eyes. Cases of strabismus can vary from mild to severe. based on the amount of deviation between the eyes. Strabismus affects adults and children in different ways. Symptoms of strabismus in children are typically mild. Parents may notice that children tilt their head to one side to compensate, or close and cover the deviating eye. Symptoms of strabismus in adults may be more severe. Patients with this condition lose their binocular vision, which can cause double vision and loss of depth perception. As a result, patients may suffer from headaches or eye strain. A stye develops when one of the glands at the edge of the eyelid becomes infected. Resembling a pimple, a stye can grow on the inside or outside of the eyelid. Styes can occur at any age. Affected areas are tender, with localized redness and swelling. They do not interfere with vision. A subconjunctival hemorrhage occurs when a small blood vessel under the conjunctiva breaks and bleeds. It may occur spontaneously, or from coughing, heavy lifting, or vomiting. In some cases, it may develop following eye surgery or trauma. A subconjunctival hemorrhage tends to be more common among those with diabetes and hypertension. As we age, the vitreous inside the eye tends to shrink and may eventually separate from the inside surface of the eye. This is called a posterior vitreous detachment, or PVD. When the vitreous pulls free from the eye, it is often accompanied by flashes of light and the appearance of tiny black spots in the vision. In general, PVDs are not dangerous, but in certain cases they can lead to more serious conditions. If left untreated, these conditions can lead to vision loss and may also lead to blindness. It is suggested that anyone with symptoms of a posterior vitreous detachment should have an eye examination immediately to make sure that a more serious problem is not present. Small specks or clouds moving in your field of vision are called floaters. Most floaters are not dangerous and are caused by tiny pieces of tissue inside of the eye. When light hits these pieces of tissue, it creates shadows on the retina that appear to float across your field of vision. It may appear that these specks are on the front surface of your eye, but they are actually inside. In most cases, floaters are no cause for alarm and no treatment is necessary. However, a sudden increase in new floaters may indicate a problem, and an eye examination is recommended if this occurs.